Hello friends, my name is Dr. Kedar Patil. I am a robotic, bariatric and advanced laparoscopic surgeon practicing at Precise Clinic in Pune. So in this video, we are going to see the key differences between a robotic surgery and a laparoscopic surgery. So to begin with, robotic surgery is an advancement in our surgical field compared to laparoscopic surgery, and in this video I'll try to explain the details of why is it a evolved form of surgery. Robotic surgery is done on organs, especially the food pipe, the esophagus, stomach, pancreas, spleen and liver. It is also useful on organs in the pelvic cavity where area is narrow, especially surgeries of prostate, urinary bladder, the uterus, the rectum. Because it has more degree of movement, it has a 7 degrees of movement, while laparoscopic surgery has 4 degrees of movements. So due to this increased dexterity or increased movements, surgery becomes relatively easy in narrow areas. So this is a point where it scores over laparoscopic surgery. The second point that we see in daily usage is because of the 3D magnification and improved vision, we tend to see very minute details when you are operating. Thereby, the tissue handling is minimal, blood loss is minimal because of increased vision and increased magnification. We can clearly see the blood vessels, preserve them, and just operate the part which is necessary. So, because of these things, the tissue trauma, tissue handling is less, and that also enhances the patient recovery. The third aspect is tremor elimination. Because of tremor elimination, when someone is doing suturing, it becomes as if the organ is in front of you and it becomes very easy. There is also an improvement in suturing as compared to laparoscopy because of this increased degree of movement of the instruments. The ICG technology in robotic surgery has become a game changer in surgeries, especially of the cancers, where this ICG, when it is injected in the blood vessels, you can see the blood vessels clearly. The lymph nodes, which are the draining stations for cancer cells, becomes easily to be detected and to be picked up and resected. So this ICG technology is an added thing in robotic surgery, which can help in improving the outcomes of this surgery. Important thing is the surgeon is relaxed sitting on the console and operating this. So if it is a prolonged and longer duration surgery, the outcomes again can be better because it's being done relatively ergonomically at a better position and with ease. The camera control is in hand of the surgeon rather than assistant, so he can decide to focus on particular area, zoom out when required. So that again shortens the operative time since the surgeon is having the camera control. Last but not the least, there is a continuous data collection as to the movements of the robotic instruments, which is fed back to the surgeon, and that is why there is a constant improvement in the surgical technique with minimum possible manipulation of the organs and instruments. That happens over months and years, so that also adds to the surgical precision. Robotic surgery requires larger operating space because the instrumentation is quite enormous in size. It also requires trained surgical staff and institutes where all the support is available. Now, when we are comparing the advantages and disadvantages of robotic surgery versus a laparoscopic surgery, the first thing that comes to our mind is the patient outcomes. The patient outcomes are better in robotic surgery because of less tissue handling and early recovery enhanced because of this less tissue handling. There is less tissue trauma, so less blood loss as well. The pain is less because of this less tissue handling. The bowel function returns back to normal earlier compared to a laparoscopic surgery. The enhanced view, the tremor elimination, the improved degree of movement of instruments, all these adds to the ease of the surgery, making surgeons and patients' life easy. There's a flip side to it. The cost of surgery is more compared to a laparoscopic surgery because of the involved armamentarium and the trained staff required for this surgery. But nonetheless, robotic surgery is going to stay, and it's the present future, I would say. Because of the improved patient outcomes, we are seeing robotic surgery being used more and more for patients, especially with complex problems, and especially those problems which are located in narrow areas. So friends, in this video we have seen the key differences between a robotic and laparoscopic surgery, the advantages of a robotic surgery compared to a laparoscopic surgery. If you like this video, please do press on the like button, subscribe to our channel. If you have any queries regarding robotic surgery, please do call on the mentioned numbers. Thank you.